Like, because in middle school, I'd only smoke like once a week. Like, that would be a big deal.
When you first start out, you're like, holy shit, I smoked today.
Yeah, because you just get so high. But then the more you smoke, the more your tolerance goes up,
like,
and then you need it more to even feel it.
People can stop smoking weed. I could stop smoking weed. It's just a matter of, like, do you really want to? It's just a matter of want, not need, I think. But mooking, I definitely believe that it's a need. People, it's hard to stop mooking. It's extremely difficult. I've tried it. It's hard on, like, not even like mental, because all you think about is wanting to take a mook, but also physically, you know what I mean? Like, you sweat more, you're more agitated, you're more angry, because all you want to do is like just release, because the high you get from a mook is totally different than smoking weed.
A mook is when you put tobacco and weed in a bowl and smoke it. So if you've ever smoked a spliff, it's the same thing, but out of a bong. It's intense as fuck. You get a head rush and you just die.
It's like that part on Spaceballs when they go warp speed and like
yeah,
the whole,
people
like,
seize.
whatever guys like flying around.
Seizures happen. So I stopped and now I'm just smoking weed and I get high as fuck because it's great.
Yeah, I've definitely seen multiple people seize.
People started mooking and everybody was like, oh, it's really gross at first in the first few months of school, and then it progressed, and then by the end of the year everybody was mooking pretty much.
We went to a mook party at Laurelhurst, and my friend took a mook with spirit, Doha, and nicotine oil on it, and she just lit it and hit it very fat, and then she just kind of like started like holding her mouth and like shaking, and then she went and laid down on the ground and started convulsing and just seizing out, and then we had to kind of help her and get her on her side, that way she could throw up. But then after she threw up, she was fine, and she just came and drank water.
So welcome back. We're continuing the talk about the science of prevention, of effective prevention, and today we're talking about the costs of addiction in our society. And right now, today, I have with me Dean Whitlock, who is a health science writer, and he's written a very important paper which has looked at the question of what is the cost of schizophrenia or severe mental illness due to marijuana use in Vermont, and can we project how that might change as we experience commercialization, more acceptance of marijuana use in Vermont. Will severe mental illness due to marijuana increase?
Well, thank you, Catherine. First, I apologize for the voice. I'm getting over a very bad cold, but luckily feeling better. But I'll work my way through it here. And I want to say that I was a co-author, and it's definitely not the senior author on this. Working with me was Dr. Christine Miller, who was a retired pharmacologist with a focus in neuroscience, and she spent most of her career doing research at Johns Hopkins. And she's been published in dozens of peer-reviewed magazines and has been a reviewer for the magazines as well, Schizophrenia Bulletin, Journal of Neuroscience, and other very, very important magazines or journals in the field. She's the one who did the heavy lifting. Like you say, I'm a writer. I have a background in psychology and biology from college, and since 2009 I've been working in the public health field, specifically having to do with the field of substance abuse prevention. Since 2013, I've been focusing on marijuana. Mm-hmm. And we hooked up in 2015. She wanted to write this article. She wanted to get it out quickly because of what was going on. So rather than try to wait for the couple of years that it takes to get an article accepted and ready for a journal, we decided to bring it out as a white paper. Mm-hmm. Though the results would have been the same whether we had waited or not. And there's a long list of citations in there of the research that she called upon to bring this together. Essentially what we did was we looked at the RAND report that had come out in 2015. And it predicted a certain growth in use if we were to commercialize marijuana, legalize it, but also make it available in dispensaries for retail sale, recreational use, as they call it. And there were a couple of scenarios. One scenario where we weren't able to undersell the black market, and they predicted that fewer people then would switch over. You'd see a smaller number of users. And then there was the second scenario in which we were able to undersell the black market, and that showed a higher number of users. So we were looking at like a 25% increase in use rate or a 54% increase in use rate. And based on what's happened in Colorado, Oregon, Washington, Massachusetts, has already happened because of their very, very permissive medical marijuana, but they'll see more of it. And Vermont would see more of it too. What we've seen is something that's in between, but among young adults, which is to say 18 to 25 years old, we're seeing 65%, 70% increase in use rate. The 12 to 18-year-olds, a very important group because they're so susceptible to the effects, we're not seeing as much, but just this past week, the new Monitoring the Future results came out showing a 10%, a statistically significant 10% increase in use rate among that age group. So what did we find? We found that calculating our current economic burden for schizophrenia, and there is research that shows how much it costs to treat a patient each year with schizophrenia, which is admittedly the most severe form of psychosis. But still, as you said, as we've seen the figures, a lot of people who develop the psychosis will go on to develop the schizophrenia. Looking at that current burden and then adding to it either the 25% increase we would expect under the one scenario up to the 54% increase in the other scenario, we saw that we would expect to see an increase from $4.9 million per year extra healthcare cost up to $11.1 million per year in extra healthcare costs. And this is in 2015 dollars. Okay. We'd have to adjust for inflation now on that. We also have to consider the fact that since decriminalization in Vermont, and we don't have the data yet for legalization of just last July, but since decriminalization, we've seen a statistically significant increase in use rates among the 18 to 25-year-olds, but also in all age groups, right, including the underage group.
Right. So when we started thinking about decrim, almost everyone was for it. It was very difficult to find someone who was against decrim in 2013. And what we heard a lot was, don't worry, that's not going to change our use rates. We're going to just it's a harm reduction method. And I think the Medical Society and various other pediatricians said, well, we need to get out in front of this and we need to do some education ahead of time. But that wasn't done. And so, as you said, the reuse rates did increase, unfortunately. And I think I've seen those statistics from the Vermont Health Department, and they show that the segments of our population in Vermont who've been most hurt were those who earned less than $25,000 a year, or those who had less than 12th grade education. So we did decrim, which we thought was a harm reduction, and we've hurt the least among us. So that was an unintended consequence, which is from decreased perception of harm.
Right. And another issue about this is that in 2015, we were looking at potencies that range from about 12% up to about 15% marijuana. And as we heard now, this is not just the extracts we're talking about. This is the smokable marijuana. This is the leaves, the buds, the flowers. We're talking that over 20% marijuana is the standard fare in Colorado and Washington and Oregon. Under the legalization regime, they have been able to increase and increase. And these high-strength potencies were first developed in the Netherlands under their relaxed tolerance of decriminalization with the coffee shops. So we can expect this to increase. I'm not sure how it could go much higher, but we can expect to see an increase in potency. And there is this dose-response relationship. The higher strength marijuana is not being used more lightly, it's being used more heavily.
That's
so
correct.
The heavy users of today are much heavier users than they were back when I was in college and tried marijuana.
Right.
So it's a very different beast.
And we did hear from the commission, the governor's commission, recently, and the health commission has come out and said unanimously that we should not have any edibles because of their link to psychosis and schizophrenia and various other mental illnesses. But that hasn't been completely embraced.
No, in fact, it has been rejected. One of the problems with politicians is that once they come out and make statements, somehow they're not allowed to change their minds. And I consider myself to be a liberal who has changed his mind. I'm a progressive liberal. I'd like to see there be universal health care. We won't be able to afford it because of the substance abuse burden, not just marijuana,
Right.
but all the substances.
Right, like Dr. Randall was talking about.
Yes,
that
exactly.
They thought, okay, well, if we legalize or liberalize marijuana, we may see an increase in marijuana use. But what she's seeing in her data and her ER is, my goodness, an increase in methamphetamines, and even her Colorado opiate, death rates have continued to increase each year. So all of the objectives haven't been fulfilled, unfortunately, and the
Not at all.
costs are laid for us to bear.
Right. And again, this whole idea of tax and regulate is based on not increasing the user rate and not increasing the amount of money that is going to be paid for this stuff. And that's simply not going to happen if it becomes a commercialized system.
Right. We had a talk at the health department. We had Jonathan Calkins was invited by Mark Levine to come and give a lecture, and his point was that if we had illegal toasters in Vermont, or an illegal industry of coats or rugs or cars or cameras, and we wanted to bring that gray market up to make it legal, when we did that, there would likely not be a 400% increase in the appetite for toasters or coats or cars. There might be a little bit, but not, but this is the point of this presentation and this series of talks, is that the industry of addiction is a different animal. So the industry of addiction doesn't operate, there's no profit to be made unless their widget is someone who has a use disorder. Yes. They want to create that person, and that's what's fueling the findings in your paper. Is that right?
Yes, that's correct. And as one thing that Christine Miller said, that if we had the evidence we have now for the schizophrenia connection, the psychosis connection, if we had that sort of evidence about genetically modified products, foods, we wouldn't be discussing labeling. We would have taken them off the market. We have disallowed them by now. But unfortunately, there's a strong industry lobby out there that is spreading disinformation and is trying to convince people that we're going to have billions of dollars flowing into our well from selling this addictive substance. And we aren't. It's not going to flow into our well.
That's right.
It won't.
That's right.
And unfortunately, we have to argue against it as best we can.
That's right. Well,
but again, if you follow the science, which is what the proponents were begging that we do when I first got involved, front page of the Marijuana Policy Project website was, let us have a science-based discussion. It's not there anymore. They took it down 3 years ago.
Really?
Because if we followed the science, they would lose.
That's right. I mean, we know from tobacco that candy cigarettes that don't even have nicotine in them are a useful tool to addict children to nicotine later on in life. And we got rid of those, right? We made them illegal, unacceptable.
That's right.
They're banned. But now we have gummy bears for children, right? I mean, there's no other reason to really make a gummy bear, a sweet red gummy bear that even has the active addictive substance in it.
And it's not just the children's stuff. As our experience with tobacco and alcohol has shown, if you want to reduce use rates, you have to reduce adult rates first. It's a follow the leader proposition. And we got billions of dollars from the tobacco industry after we sued their pants off to try to get use rates down. And we did that throughout the population by essentially vilifying tobacco.
Right.
And so nobody wants to go into a restaurant now where people are smoking. They don't even want to walk past the smokers standing outside the door.
Right.
But we're not doing that with marijuana. We're going the other way. We're increasing the use rate of adults. And therefore, the use rate of kids will go up.
And
it's a given.
Absolutely, and of course, it's very important to realize that it was impossible to do any of the reduction in tobacco until we were able to, I don't know if the word is convict, but they were found guilty of racketeering. That means in a closed brick building in Durham, North Carolina, with the shades down, they had the smartest guys in the room, marketing and scientists and neuroscientists, trying to figure out what Joe Camel would be most appealing to how many kids, and what combination of nicotine on the leaves would be most addictive to children. And that all in the face of knowing that they were killing 400,000 people every year and continuing to do it. And so it's that knowing that there's a problem and still continuing to market to children. And unfortunately, because of the appetite for profit, we're seeing that again with the marijuana industry. Just an example, the for-profit medical marijuana industry in Colorado, there was a recent study in, I think it was JAMA, 70% of medical marijuana shops are so interested in profit that they will tell a pregnant lady that it's okay to smoke marijuana while she's pregnant. I mean, that's just...
And you have to understand, too, that most of the bud tenders are not trained pharmacists. Right. They are not in the scientists. They do believe that it will help.
Right.
It's the people who are their bosses that are not telling them to stop.
Right. So I want to give you all the time you need, and then we have someone who's been adversely affected personally by the marijuana industry, targeting her child, and she wants to tell that experience.
Well, I don't have too much else to say except to repeat that the data that we have linking psychosis and schizophrenia to marijuana use is as solid as any we have linking tobacco to cancer. And we know that the higher strengths lead to worse effects. There's a dose-response relationship here. We have to pay attention to that. We have to address not just the kids, but the adults as well. And that there's no way the tax money will pay for operational costs, enforcement costs, education costs, health costs, traffic accident costs. And by health costs, it's not just the psychosis. It's the mania and bipolar disease. It's social anxiety disorder. It is the link now that is growing stronger and stronger with more and more research all the time, the link now between suicide and marijuana, and the link between co-drug use. Again, the Monitoring the Future found vaping has gone up, marijuana use has gone up, and kids are using tobacco and marijuana together.
Yes, yes, and that's what this show is also going to have, that clip from the film from a high school student from Portland, Oregon, who did an independent film in his high school, and shows that kids who are using marijuana and tobacco together are actually seizing, and this is new information. It's almost every physician that I show that clip to says, "Wow, I learned something." Kids can seize from high-potency THC combined with nicotine. So we'll have that as part of it so that the audience can see those clips as well. So we'll turn to Aubrey. Welcome, Aubrey, and thank you for being willing to share your experience with us.
Oh, thank you for having me. It's a very important topic, and this issue affects so many other issues. I was really appreciative of what Dean just said about healthcare. If we're addicting more people and we're causing more problems, we're not going to have the money to give health care, to afford health care for everybody. And that's what I keep scratching my head about. Why is our country doing this to our people? We want a healthy country and we want everybody to have health care, but there's no way we can afford more mental illness and addiction. So I really appreciate that. Did you just want me to talk, Catherine, or?
So, we've heard providers, we've heard lawyers, we've heard, researchers talk about what they've found in figures, but you've experienced it firsthand. We do have an anonymous writer who's written in a Vermont newspaper, and I think that perspective would give the audience an idea of what it feels like to be touched by marijuana-induced mental illness or illness.
Sure, I'll start with that letter, and then I'll talk a little bit about what it cost my family and my community. So this is an anonymous letter from a Vermonter, and he starts and he says, "When you praise the personal freedom and beneficial tax receipts designed for legalization of marijuana, you must also count the unintended consequences that occur because of it, like the 5 teenagers lifeless on the interstate because of a driver impaired on marijuana. The dad who, while under the influence of THC, leaped out of a multi-story building holding his infant child. It encompasses the growing burden put on the ER department, our sons and daughters, who were well on their way to contribute greatly to society before marijuana triggered their mental psychosis. They were pre-med students. They were valedictorians. A few wanted to serve their country via the military. Some were too young to have career ambitions before marijuana triggered them into the whirling diverse of mental illness. All too many could not cope with their triggered mental illness and willfully committed suicide, while others succumbed to overdoses. Family members have spent life savings in hopes of incurring onset marijuana-induced schizophrenia, spending thousands on court fees, attorneys, private investigators to locate their missing young adults. We've set our retirement dreams to the wind. These are the real stories that are never seen on national news. And that letter breaks my heart, and I can relate on so many levels. And my son is only 18 years old, but it started when he was 14. And financially, I can tell you it cost me about $70,000 a year. Not a year, I'm sorry, $70,000 since we started when he was 14. That's not including what the state of Colorado has already paid. They paid a home therapist $2,500 for 8 months of treatment within our home, and they paid $5,500 a month for 3 months for a 90-day residential treatment program. And that's not including all the meds and everything that went with it. I can tell you I currently still owe $25,000 for treatment, and my monthly payments on all the programs that my son is part of cost me $850 a month. And I've been paying that fee and it just went down to $850. I was paying between $1,000 and $1,200 a month for the past 2 years while he's been in an intensive outpatient program, an alternative peer group, and adventure learning program. Every ounce, every penny I have spent has been worth it. I have no savings. I live paycheck to paycheck, and I'm considered middle class. I would like to tell your viewers and the people of Vermont and the policymakers of Vermont, the poor families, some of those children don't stand a chance because the families do not have the resources at all. I'm a pretty stubborn mom. I fought really hard to continue to find treatment, and when one door closed, another one would open. There was a period of time during my son's addiction, mental health cycles that I had walked away from my job. I could not trust him to be in the home alone with my younger son. I could not trust community members not giving him marijuana. So I was at home and walked away from my job, and he was relapsing and still suicidal at times. And every time I would take him to the ER, it would cost me between $500 and $800. And I was looking for treatment, even though he had already been in a psych unit twice and had the 90-day treatment program with the Department of Social Service, plus the 8 months of a home therapist. There was a period of time he was on the streets, gone for up to 5 days. And I had found a treatment center in Utah. Utah is full of treatment centers. And they said I could come. I had private insurance. So they said, you can bring him. And we had done an intervention with the ER staff, and he accepted that he needed help and was willing to go. And it was a working cattle ranch he was going to go to, and I had went and got him the clothes and everything he needed. And the night before we were supposed to leave, the executive director called me and said, unless you have $36,000, you can't bring him. And I didn't have it. I think I had a couple $100 in my checking account at that point. So once my son, he was pretty sick at that point, vomiting a lot, only testing positive for marijuana. He was very thin. When he started feeling better and he knew I didn't have the money to send him anywhere, he was back on the street. So the financial burden is not only to society, but it breaks the families. And there's no savings left. There's nothing left, though the families are willing to spend whatever it takes to get your child treatment and get them healthy. The monthly fees I pay for the programs even now is because I am so committed to him being healthy, and he is stabilized, and he is doing well, and he's progressing well. He is not in high school. He will probably eventually get a GED, but his education, his academic education, is put aside, where his main priority is his health, his mental health, and learning how to contribute to society and serve society. So I appreciate the opportunity of giving a perspective of a family. I have families call me all the time asking me for help and saying they don't have the money. There's lots of treatment programs that have popped up that are taking advantage of these vulnerable families, telling them they need to pay them thousands of dollars to help their child, and they end up being a scam. So they're feeling there's people making money off addiction and mental health, not just in the marijuana industry, but unfortunately, to get the bad actors in the recovery community too.
I guess I also wanted to add, we tried to invite a Vermonter who's been affected, and there's quite a stigma. And we had one person lined up, and they were embarrassed and didn't want to expose their loved one. And I think that in Vermont we have less stigma around addiction. We're working very hard on that. We have less stigma around mental illness, but marijuana-induced mental illness, I don't see people coming out and speaking about that publicly. It feels like, in Vermont, there's duct tape on a whole community of people, and I don't completely, I can surmise about why that may be, but it is unfortunate. I think that it partly has to do with an extremely powerful industry in Vermont, which is marketing marijuana as healthy, as marketing marijuana as good for the economy, and that if you say anything, that, well, it caused severe mental illness to my loved one, and my whole family was affected, economically, psychologically, or whatever, you're not cool.
I don't think it's just in Vermont, because I have a family connection in Massachusetts where one of the family members started using marijuana to deal with other issues, self-medicating, and it made all of them worse, became an addiction, and the rest of the family didn't learn about this for a long time, because there is a certain amount of shame involved in substance use addiction. And it's been seen for generations as a moral failing, and it's something that we are trying as a society to come to grips with, to understand that it's not a moral failing, it's actually a physical thing that happens. Marijuana is just as physically addictive as it is psychologically addictive, and so are all those other drugs. And we're ashamed of that. We're ashamed of mental illness. It's a weakness that we try to cover up. It's absolutely endemic with our society. And I'm sure Aubrey experienced it as much as we did here in Vermont. And, we aren't upfront about this.
No, we aren't.
And we don't admit to it. And the state institutionalizes that by not putting forth enough money to deal with it.
Or even to educate.
Yes.
I mean, it is true that this idea that marijuana causes psychosis is relatively new. I remember in 2013 being in the State House and saying, to David Zuckerman, I think this is the problem. I think you should pay attention to this. And the response I got was, I don't think that's a real thing, or it was going to happen anyway, or it's such a small group of people. And I think the other thing that comes up for this is we're getting a lot of traction in the State House and in the state in general about this idea about ACEs, so adverse child events, which have such profound impact on a person's, whether they develop cancer, whether all these other, psychological problems of what they're going to earn and how happy they're going to be long term in their life and whatnot. What we what we know now is that if someone in your family develops severe mental illness, you have 5 people who've then been affected by a severe ACEs event. And so if, as we go forward, as the industry makes this more acceptable and plays down the negative costs or the negative ramifications as they did with tobacco, we're going to have more and more innocents impacted by someone in their family who's been hurt.
That's right. And I really appreciate you both bringing light to the stigma. I agree. It is a nationwide thing, and it's a messaging that the Drug Policy Alliance and the marijuana proponents have just completely manipulated the country into thinking marijuana is harmless, and the people that are mentally ill do have some kind of moral problem. I was so desperate after I didn't have the $38,000 to take my son to that treatment center. I made a GoFundMe page, and I thought, there's got to be somebody out there that's wealthy that understands addiction and mental illness, and they're gonna fund me. They're gonna contribute to this. So when I made the fundraiser, and I keep it up there still, and I think I asked for $80,000 on my fundraiser because they told me my son would be there a year or more, and I think it was $12,000 a month, right, that they were charging. And then the pro-marijuana people came after me, and they wrote awful, awful things to me, and they called me a liar. And I had grown some pretty thick skin by then because I had pretty much lost a lot of my friends. Because of the stigma, but also because your friends are very uncomfortable about what's happening, and they look at you as a bad parent too. I mean, like, nobody was bringing me casseroles or anything, or having like a spaghetti fundraiser to help, or anything like that. You do become isolated. So there's a lot of families out there that are suffering in silence, or not even realizing that marijuana is the root of the cause of their problem. So there's a few parents like me that do speak up. Most of the parents that contact us don't want to speak up because of the stigma, and just being embarrassed about it, and because of the harassment they get. That is the main reason. I've had parents that are willing to speak up, but they just say, I can't do this anymore. It's causing me so much stress. I just want to live a quiet, happy life. And also, when you talk about the trauma that comes along with it, there was a moment when a police officer was in my home counseling my son and me about what was happening. And the officer looked over at me and he said, Mrs. Adams, you really have to watch your younger son. What happens with these families, when one child goes down this road, the other child gets lost, and they end up being suicidal, severely depressed, and stuff like that. And that is true. My younger son has developed depression and anxiety, and he is actually part of the recovery community here where I live in Houston, even though he doesn't have a substance abuse problem. So that's a big warning to families, that are going through this.
Right.
Make sure you're looking at all your kids and making sure that not only are you getting treatment for the one with the substance abuse problem, but the other kids, too, that are experiencing all this trauma. It's such a snowball effect on our society.
Correct. Well, thank you very much, Aubrey, for contributing that. I think that, that's really gets us back to the theme of our series, which is prevention, science of effective prevention. And we really need to focus on the Icelandic model focuses on the environment. It's non-judgmental. It doesn't expect children to have to say no. It really expects parents to step up and create a healthy environment. And for that, we need the resources that are now slipping through our fingers because we have an avarice industry which is targeting the children as they're popped into the world. And that's something that we'd like to increase the awareness of and hopefully get people engaged. So thank you very much for joining us. I hope this has been informative and helpful. And as always, we look forward to your feedback. And thank you. Thanks, Dean. Thank you, Aubrey.
Thank you.
Bye, Aubrey. Thanks.
Bye-bye. Thank
Bye.
you.